We're here at the U.S. Space and Rocket Center in Huntsville, Alabama, home to the Saturn V rocket. Thousands of Alabamians helped put humans on the moon on that rocket. But there are over 300,000 individuals in Alabama who lack health insurance because of our state government's failure to expand Medicaid. If you were to stack all of those individuals with families, lives, people they care about, and communities in Alabama, if you were to stack them on top of one another, it would be equal to 1,091 Saturn V rockets. Think of that. 1,091 rockets tall. That's how many Alabamians are in the coverage gap. It's devastating our economy, it's devastating our communities, and it's devastating our hospitals. We joined the Southerners for Medicaid expansion because we believe in healthcare for all, not just some. It's time for Alabama to expand Medicaid, and it's time for the rest of the South to catch up and expand Medicaid as well.
In 2010, the landmark Patient Protection and Affordable Care Act was passed in the United States.
And we have now just enshrined the core principle that everybody should have some basic security when it comes to their health care.
This law fundamentally reformed how coverage worked in the United States and expanded health insurance to millions of Americans. Under the Affordable Care Act, or ACA, people living at 138% of the federal poverty line or below, including childless adults who were previously ineligible for Medicaid, now could get health insurance through that program. Those who were making between 100% and 400% of the federal poverty line were eligible for financial subsidies or financial help to help assist them in buying coverage. The Affordable Care Act did in fact make care more affordable for some people in some states. In June of 2012, the Supreme Court ruled that requiring all states to expand Medicaid was unconstitutionally coercive. Therefore, each state would get to decide for itself whether or not to expand the program. The states that chose not to expand Medicaid created huge gaps in coverage for some of their poorest and most vulnerable people. The gap is often referred to as the coverage gap, and you won't believe what it really means. Let's take a single mom who lives in the South and works full-time at her minimum wage job. She earns $290 a week, or just under $14,000 per year before taxes. Her income puts her squarely in the Medicaid gap. She's making too much for Medicaid, but not enough to qualify for a subsidy through the healthcare marketplace. Her child would have access to Medicaid, but she would not. To be covered, she would have to pay full price for basic, high-deductible health insurance. The current market rate for this would be almost half of her income. In the South right now, there are roughly 7 million people with similar stories, many of whom are the same folks who delivered our groceries or fulfilled our online orders during COVID-19. Many states who initially opted out have since chosen to expand Medicaid, closing the coverage gap in their state and giving more people access to affordable coverage. Now it's our turn. It's time for Alabama, Texas, Tennessee, Mississippi, Florida, South Carolina, North Carolina, and Georgia to expand Medicaid and make sure people can get the health care they need during COVID-19 and beyond.